Good day everyone, this is Mary Rosie Garcia, a second-year nursing student from Section WIEDENBACH. So for today's video, I'm going to perform topical administration medication. Topical administration of medication is where drug is directly applied to a body site. First, we have to observe for open lesions, rashes, or erythema, and skin breakdown. Second is to assess the patient for any allergies. Verify the patient's name, dose, route, and time of administration. Assess the patient's knowledge of medication and procedure. If the medication affects the patient's vital signs, assess them before administration. To promote the absorption of medication more rapidly through the use of topical medication. To treat skin disorder and lesions caused by burns and abnormal growth. To dilute the effects of drugs. To apply an agent that stops and prevents the growth of microorganisms. To provide local anesthesia to a specified part of the body. A. Nursing measures for applying medication on the patient's skin. Number 1. Be sure that the skin is dry and clean before applying anything on it. Most often, previous preparations are removed before applying additional medication on it. Except in the case of lotion used for soothing the skin. Number 2. Clean the skin with soap and water before applying preparations of medication to the skin. Next, remove substances of the skin that will delay absorption of the drug. Number 3. Apply local heat in the area when indicated. This measure promotes absorption by improving blood circulation to that certain area. Number 4. Shake lotions, which are suspensions of the powder, before using so that the active ingredient reach the skin in the desired amount. Apply lotions with cotton balls or gauze. Thoroughly massage creams and ointments into intact skin, or if this is contraindicated, pat them onto the skin with the fingers. Letter B. Typical preparations apply to the skin area and their primary purposes. The powder promotes drying and prevents friction to the skin. Ointments provide prolonged contact on the skin and softens the skin. Creams and gels are used to lubricate and soften the skin and prevent the skin from drying. Lastly is the astringent and alcohol are used to cool and dry the skin. The equipment, we need to have medication card, medication container, application tube if needed, and tongue depressor or tongue blade, gauze, sterile gauze, and gloves. Step number 1. Gather equipment. Check medication order against the physician's original order according to agency policy. Clarify any inconsistencies and check the patient's chart for allergies. This comparison helps to identify errors that may have occurred when orders were transcribed. The physician's order is a legal record of medication orders for each agency. Step number 2. Know the actions, special nursing considerations, and safe dose ranges, purpose of administration, and adverse effects of the medication to be administered. Consider the appropriateness of the medication for this patient and perform hand hygiene. This knowledge aids the nurse in evaluating the therapeutic effect of the medication in relation to the patient's disorder and can also be used to educate the patient about the medication. Hand hygiene deters the spread of microorganisms. Step number 3. Place medication on a tray or move the medication cart outside the patient's room or prepare for administration in the medication area. This organization facilitates error-free administration and saves time. Step number 4. Transport medications to the patient's bedside carefully and keep the medications in sight at all times. This careful handling and close observation prevent accidental or deliberate disarrangement of medications. Step number 5. Identify the patient by checking the name and identification on the patient's identification band or ask the patient to state his or her name. This step ensures the right patient receives the medication and helps prevent errors. Step number 6. Explain procedure to the patient. This could help to gain cooperation and to allay anxiety. Step number 7. Cleanse skin surface with soap and water unless contraindicated by patient's condition, and dry thoroughly. This could remove old ointment and replace with a new one. Step number 8. Squeeze medication from a tube or using a tongue blade. Take ointment out of tube or jar. Step number 9. Spread a small, smooth, thin quantity of medication evenly over patient's skin surface using your finger or a tongue blade to provide an occlusive effect. Step number 10. Protect skin surface with the dressing if needed so that medication cannot rub off. Step number 11. Assist the patient to a comfortable position to ensure patient's comfort. Step number 12. Evaluate patient's response to the procedure and medication. The patient needs to be evaluated for any adverse effects from the medication or procedure. Step number 13. Perform hand hygiene. Hand hygiene deters the spread of microorganisms. Skin returns to normal state. Desired therapeutic effect is obtained. Experiences no adverse effects including allergy response, systemic effect, or injury.